Good afternoon. We are Group 2 and we're going to be covering the mental health of nurses post-COVID. Nurses' well-being, or lack of, has impacts on nurses, patients, health organizations, and society. Well-being affects individual nurses in terms of mental and physical health, joy in the meaning of their work, professional satisfaction and engagement with their jobs. Nurses' well-being affects patients in their perceptions of the quality of care they receive. And it also affects the healthcare system, impacting turnover rates, the healthcare system, cost of hiring, and training new nurses. With more than 1 million nurses projected to retire between 2020 and 2030, retaining established nurses and supporting new nurses is vital to growth and sustainability of the workforce. According to the National Library of Medicine, as nurses struggle to manage the high workload in times of uncertainty, they became physiologically affected during the pandemic and reported experiencing increased stress and burnout, leading to experiencing depressive and anxiety symptoms.
Go.
Quantica has been a nurse on the med-surg floor for 7 years. She is currently going through a divorce. She has 2 children and little family support. Quantica was diagnosed with anxiety and depression after working through COVID. She chooses not to take her prescribed antidepressants because she fears dependence. However, Quantica drinks 4 to 6 glasses of wine nightly. She is often late for her shifts. She needs help to complete tasks, and she started calling out of work on a weekly basis. Her coworkers voiced their concerns to their manager. They believe they smelled wine in her Stanley cup. She was referred to Employee Health by the Office of Human Resources.
Hello, Miss Q. My name is Sarah, and I'm going to be your nurse today. Is that okay?
Yes.
Awesome. I'm going to sit here at my computer for a second, and we're just going to talk for a second, okay? Now, could you give me your name and your date of birth?
Quantica, and my birthday is 11/1/1987.
Okay. And what brings you in today?
Well, I was referred here for my job for a little bit of depression and work troubles.
And that's what I'm seeing on the computer, that you were referred. Okay. So, sadness. You've been feeling sad lately.
Yes.
Okay? All right, so we're going to put that as your chief complaint. Are you on any current medications?
No, I'm not taking anything currently. I was prescribed some antidepressants, but I don't take them.
That's what I was about to say. I see in your past medical history depression
Yes.
since the pandemic happened,
Yes.
and that you were on Lexapro,
Yes.
but you're not taking it.
No.
Okay. When was the last time you took it?
Well, I never really started them. I have a family history of
Okay.
addiction, so I didn't want to go down that same path.
That is understandable. However, Lexapro does help with your depression, so we do have to take our medicine. Okay.
Yes.
Do you feel better when you're on the medicine?
No, I just usually pray, and I feel better after I pray.
Okay. But when you were on the medicine, was there anything making you not want to take it?
It made me really tired,
Okay.
and I couldn't sleep at night,
So
and
it
it just had a lot of side effects.
Yes, ma'am. Okay, so it sounds like you weren't liking the side effects and that you found Jesus, comfort in Jesus. So you are religious.
Yes.
Okay, so how do you do your religion? Like, do you go to church?
I go to church on Sundays,
Okay.
and I pray every day.
And did you go recently? How's your attending of church? Do you go regular?
Yes.
Okay, awesome. So you've got a good connection with faith.
Yes.
Okay. Well, with the depression, you have to take your medicine. Now with that, you say there's side effects, so I can talk to the doctor and we can see about another medicine maybe for the depression, another antidepressant. But we gotta take medicine, okay? I do see that your weight has increased recently.
Yes.
Okay. So how's your activity level?
Well, usually after working all day, I come home and go to sleep because we're really understaffed at work. So I come home and go to sleep.
Okay. And how long do you sleep? How many hours?
About 3 to 4 hours a night. Yeah, I don't sleep much at night, and sometimes I do drink a few glasses of wine in order to get myself to sleep.
Okay. Can you describe the few glasses of wine?
So I usually drink like half of a Stanley cup every night.
Okay, so we're talking maybe 15, 20 ounces
Yes,
every night.
every night, except for Sundays. That's when I go to church.
That understandable again. Okay. Well, that's probably not the best either, Mrs. Okay? Because that much wine on you, that's probably contributing to the weight gain. Okay? So let's talk about your coping. Do you work out? Do you exercise? Go for walks?
No, I don't have time just with my work schedule, and I really just don't feel like it.
That might be because of your medicine. Not taking the medicine. That's why we have to take our medicines. We'll see about getting another one. Let's talk about that referral. So you were referred by HR.
Yes.
Okay. Now, do you understand what this means?
No, I don't understand.
Okay. So it's not the end all be all. You're not going to lose your license automatically. The company that you work at, the facility, your supervisors have decided that they want you to attend, first off, this visit here, and attend groups such as AA, attend a little program in-house to get treatment, because we care about you, Ms. Keith, okay? We want you to stay a nurse, okay? Do you mind if I get some vitals in you?
You can get vitals.
Are you in any pain today?
No, just emotional pain.
Emotional pain?
I'm going through a divorce.
I'm so sorry. How long have you been in this divorce?
We just started the proceedings, and he's trying to take our children.
Trying to take the children?
Yes.
Can you put your hand like this for me? Thank you. Ooh, you got a good strong pulse though. Alright.
It's not.
Okay, Miss Q. Is it okay if I take some vitals today?
Yes. You can
Okay.
take them.
Some time passes. Okay, Miss Q, would you like to know your vitals?
Yes.
Okay. Your blood pressure was 140/90. Respiratory rations was 18. Your temperature was 98.9 and your heart rate was 88.
Okay.
So as you can tell, your blood pressure was a little higher than we would like.
Yes.
Okay. That might be because of the increase in weight recently. Okay. And that's because of the overall sadness, you think?
Mhm.
Alright. So, what else has been making you feel a little bit down? Is anything else been making you feel down?
Yes, I'm currently going through a divorce,
Oh.
and he's trying to take my children.
Oh my goodness, I'm so sorry. That's such a hard thing to go through.
Yes, it is.
How many kids do you have?
2.
Two. Okay. And so how often are you seeing them at this point?
Well, I see my kids every day when I get home, so right now I
Okay.
have them.
So that's something. So, the biggest thing, Miss Q, is, as we talked about earlier, you're here because of referral.
Mhm.
we want you to continue this, okay? Because we don't want you to lose that license. And, you need to think about your kids. Keep them as your motivator, okay? So, a good thing to have is a personal mantra or saying in your head or an image. So, think of your kids. When things get hard, think of your kids to keep you going. You got through nursing school.
Yes,
That's no easy thing.
that's
So,
true.
I think you can get through this, okay?
Thank you.
And we are here for you, okay?
Hello, I'm Taylor. I'm a community health nurse.
Hello.
Can you tell me your name and birthday?
Yes, Quantica, 11/1/1987.
Alright, cool. So I have been advised that you have been diagnosed with anxiety and depression,
Yes,
and that you have some substance abuse problems.
yes.
Okay, so I am here just to go over some stuff that is gonna help you.
Okay.
Before we do that, do you have? I know you go to church.
Mm-hmm.
Do you have any kind of support system there that can help you?
No, I don't have a lot of family or friends.
Okay. Would you like to do group counseling or one-on-one counseling through
I'll-
services?
Yes, I'll try group counseling first.
All right, cool. We can get that set up as well. In this pamphlet are just some community resources to help you get through the anxiety and depression. You can look through it. There's it explains what depression is and some risk factors that go with it and some signs and symptoms. And then on the back there are some facilities that you can maybe look into, as well as us getting you set up as well.
Thank you.
Do you have any other questions?
No, I don't.
All right, cool. We'll get that all set up.
Thank you.
2, 1.
As you can see, substance abuse and depression are major issues among nursing. According to the Clinical Journal of Oncology, substance abuse among nurses, approximately 10% of the nursing population has a alcohol or substance abuse problem. 6% has this problem serious enough to interfere with work and life.
Impaired nursing practice, from the same article, is defined as a nurse's inability to perform essential job functions because of chemical dependency on drugs or alcohol or mental health illness. Nurses must not only be patient advocates, but advocates of other nurses. So if you see something on the job that's suspicious of a coworker as a nurse, speak up. We advocate for our patients and our coworkers and ourselves.
So according to group therapy and substance use treatment, group therapy used extensively in SUD treatment consists of individual theoretical approaches adapted to the development of specialized manual-based group treatments. Several core processes predict outcomes in many SUD group therapy settings, including therapeutic alliance, group affiliation, and cultural response practices. Across the continuum of care, group therapy can be an effective and efficient modality for improving treatment engagement, developing and practicing coping skills, and supporting recovery. Group therapy is one of the most common approaches in SUD treatment settings. There is broad need for clinical supervision and formal training in specific group and processes and dynamics, as well as evidence-based SUD group therapies. Group therapy has therapeutic advantages. It provides a potential benefit in promoting social support, reducing isolation and stigma, and developing effective communication and interpersonal skills, and practicing recovery-oriented coping strategies with group members. Also, with legal and ethical responsibilities, healthcare workers have a legal and ethical responsibility to protect the patient they care for. When these responsibilities are ignored, patients suffer. Additionally, healthcare workers can be held responsible for these behaviors. Ethical behavior or responsibility is doing the right thing for the patient. Employers and nurses are ethically bound to protect their patient, the community, and the profession. Colleagues, nurses, leaders, and even administration are also required to prioritize patient safety, meaning that reporting an impaired nurse is necessary so that they can receive appropriate treatment and care.